Wearing a mask may reduce how sick you get from COVID-19. It has been thought that mask wearing mainly benefits the people around you. However, scientists are beginning to speculate that masks may also help the wearer. It is known that a lower viral dose can lead to less severe illness. Wearing a mask may reduce the amount of virus that gets through to the wearer. Less virus getting through may translate to less severe illness if you do become sick. All data and statistics are based on publicly available data at the time of publication. Some information may be out of date. Visit our Coronavirus Hub and follow our live updates page for the most recent information on the COVID-19 outbreak. Up until now, scientists have thought that the main trusted source of wearing a mask is to protect other people. Now, however, some are beginning to speculate that mask wearing may provide a form of protection for the wearer as well. They say that masks may reduce the amount of virus that reaches a person, potentially leading to less severe illness if you do become infected. This means that COVID-19 may be able to spread throughout the population, getting us closer to herd immunity, without affecting people as badly as it otherwise would. In fact, mask wearing may be one reason we have seen so many cases of mild and asymptomatic illness. How masks protect other people. COVID-19 is believed to be spread by the virus-containing droplets, trusted source that are released when people speak, cough, or breathe. If these droplets land in another person's mouth or nose or are inhaled from the air, they can infect that person and make them sick. According to Robert F. Gary Jr., Ph.D., Professor of Microbiology and Immunology, at Tulane University School of Medicine, a mask provides a physical barrier to catch those droplets. In fact, cloth masks can block about 40 to 60% of the droplets, said Gary. N95 masks, trusted source, can do an even better job, blocking 95% of very small particles, including viruses. Masks capture these droplets before they can reach other people and infect them. How masks might protect the wearer as well. Gary said it goes back to the idea that the size of the inoculum, the dose of the virus, determines how sick an individual will get. Usually, with viruses, the higher the dose, the sooner symptoms develop and the more severe the illness is, he explained. Based upon this idea, Monica Gandhi, MD, mile per hour, and her colleagues at the University of California, San Francisco, have proposed that mask wearing could help reduce the severity of COVID-19 when people do become ill. If a lesser quantity of respiratory droplets make it through to the mask wearer, this means they receive a lower dose of the virus. A lower dose means that, even if the person becomes ill, it may not be as severe a case. Gandhi noted that there is evidence in the literature indicating that this may indeed be happening with COVID-19. In a recent hamster study that simulated masking, the masked hamsters were less likely to get COVID-19. They also had milder disease when they did get it. In addition, epidemiologic evidence in settings like cruise ships and food processing plants has shown higher rates of asymptomatic infection after mask mandates were instituted. She also pointed to a paper trusted source that suggests that universal masking in situations like hospitals has led to asymptomatic infections. According to the paper, many healthcare workers have had positive antibody testing for COVID-19 even though the workers didn't know they had been infected. Finally, she said, many countries that have population-level masking have done better at keeping their rates of severe disease and death down.